Okay, guys, the next thing that we're going to talk about is your abduction pillow slings. A lot of patients that come out of surgery, if they've had a rotator cuff tear, or if you have a Bankart tear and you've had a repair of that rotator cuff or your anterior or posterior labrum, you come out with an abduction pillow sling on. And essentially what it is a sling with an abduction apparatus. We don't actually have the pillow here, but this is an abduction apparatus that puts your arm in some form of abduction or takes your elbow away from you. So this is to take some of the tension off of your cuff. And so when you come out, obviously this thing has a lot of working parts, but when we put this on you during surgery, you get home, you didn't see it get put on. And so sometimes people have a question about how it got put on, how am I supposed to get out of it, and then once they do get out of it and they get the dressings off, how do I get dressed with it? And then some people also have some problems with actually keeping this where it's supposed to go and actually getting it to fit appropriately. So we're gonna kind of demonstrate some of the things that we can change with this regarding the sling. And so there are a couple of parts that are moving, and so one thing is if your hands are a little bit further back and you want to have them out, and you want to flip these things back, you can, because they have Velcro on them. So we're going to just pull this apart just a little bit, and we're going to flip this back. And the neat thing about this is that it lays right over the top of this portion, which is the portion that's attached to the sling, the portion going around your neck. And so you just Velcro these back, so your arm and or your hand doesn't seem like it's just so far back in the sling that you can't see them. In addition, some people have a problem with these strings on top. If they get a little bit tight, they can compress the top part of your hand here in between your thumb and your index finger and the web space here. There's a nerve that runs there. It's the superficial radial nerve, and sometimes people can get a little superficial radial nerve palsy or a little numbness or tingling here. And so these things can be released. There's a little Velcro on the back here, so it sticks to the sling or to the material here. But you can pull this off and you can release it so that you can actually allow this to come out a little bit further. There's one on the bottom as well. So you can tighten and or loosen that as you need to at your comfort. In addition, if you just don't want to use this at all, if you say, look, I'm tired of putting my hand around this, you can take this thing and you can either put it next to you in the sling if you'd like, or if you just say, look, I'm tired of it, just cut it. You can cut it here and you can pull these off and pull these off, and you can just use this thing by itself as a squeeze ball, okay? So we're gonna put Kelsey's fingers and hands back around there, and they're indented so that you can actually put your hands. All right, next thing is there is a strap here on the side. This strap allows you to close the sling down so that there's not as much space here in the front or on top. And so I always tell you if you do a left-sided, if you got a left-sided sling on, or if you did your left side, open it from this side. If we open it from this side, and if we did it on the right side, then you're gonna open it always from the outer side, okay? And so one other feature is that there's Velcro on the back and Velcro on the front. So sometimes you come in the sling, the portion that goes around your neck to help give you a little bit of support here, maybe it's too far forward or too far back. One way you can help that is to adjust this by, you can tighten it by pulling up and readjusting here. You can slide this under, or you can, we'll have Kelsey turn back around. You can adjust it by pulling from the front. And so we've already adjusted hers, so hers is actually sitting pretty nicely on her, okay? So when you go to bed for the first couple of weeks, and when you get up for the first couple of weeks, for the first 2 weeks at least until you see me back in clinic, you will need to have this sling on with the abduction pillow. And that's just to prevent the cuff from having tension, because if your arm's in this position, that cuff that we've repaired, we've attached the tendon back to the bone. And so if your arm is in this position, there is a downward force pulling on the cuff. And so to take that downward force off, we allow the arm to be abducted a little bit so it doesn't put any tension on. I usually will tell you you can get out of this the next day when you're seated, obviously with some arm rest. And so if we demonstrate with the arm rest, if we are seated and out of the sling, So if your arm, you're seated, and we're gonna use just the left side. So if your arm's in this position, and let's just say you wanna type on a computer, you wanna read a book or a newspaper, things of that nature, you can do that and have your arm completely out. You can take the entire contraption off, and you have your arm in this position. You can do the same thing that sling is doing. So when you are in this position during the day, we do want you doing those passive range of motion exercises for your shoulder. So if you want to sit and slide to the side of the chair here to do some pendulums, you can, okay? And so you can do those here. And we also want you to do some active range of motion exercises with your elbow, wrist, and finger. So I'll have you slide over in the chair and all the way down with your elbow, all the way back up. You'll do that 10 times. You'll do pronation, supination. So pronation is here, supination, palm up. It's just like you're holding a bowl of soup. And so you'll do that back and forth 10 times, and then you'll also do some wrist and finger range of motion exercises as well while you're out of this thing. But for the first 2 weeks, this needs to be worn because it helps to keep tension off the cuff. If you are unable to get into clinic because of the virus, which most of you are at this point in time since we're only seeing urgent emergent stuff, at the 2-week mark, I will tell you that you can come out of the abduction pillow portion, okay? So we are going to, instead of having, so if Kelsey has had her cuff repaired, we don't want her lifting her arm away. So we're gonna have her just kind of hold here, and if you have a family member who can essentially gently lift this thing away, the Velcro will come off because it's Velcroed on, and just unsnap here. Then this whole thing will come out, and having the arm down at this point with the sling on at the 2-week mark is probably fine. It's not going to put too much tension there because it's had 2 weeks to kind of go through the first phase of healing, which is inflammation. So I think those are the most important points of this initially for those people in the first couple of weeks. Aside from when you are taking the sling off and putting it back on, you unstrap here, and loosen this, and all you want to do is have that thing slide around your hand so you don't have to lift it, okay? And in addition, if you are going to put a shirt on, or if you are in the shower, things of that nature, obviously you don't want to lift your elbow. Remember, we said don't lift your elbow actively away from your body. So the way you want to put a shirt on is you always want to take the shirt, take it, now if it's your left arm that you had operated on, you want to put your left arm in first, pull the shirt up and over your head, and you can grab here, as you can bend your elbow, grab here, and you can put your arm through the shirt on this side. And when you're taking it off, you want to go backwards, pull the good side off, pull it over your head, pull it down and around this arm on this side. When you are standing in the shower, most people want to shower the next day. I let you shower the next day because we use a little Dermabond for your wound unless you're allergic for some reason. You can take all your dressings off, and as long as there's no issues with you having Dermabond on there, Dermabond will be on your wound so that it's waterproof and you can shower. But when in the shower, left foot forward if it's your left side that you've had operated on, right foot forward if it's your right side that's been operated on. And so because we're going to do the left side today, we're going to put left foot forward, right foot kind of scissored behind us, and then we're just kind of lean forward a little bit and let gravity take your shoulder away from you. Kind of keep your elbow locked at 90 degrees, and then you can wash underneath your arm here with the soap and the water. And then once you're nice and clean under there, then you can kind of go back to this. It is okay for you to bathe on this with your left side and or your right side as long as your elbow isn't being brought away from your body, okay? After you pat your wounds dry, as long as there's no drainage at all, you don't have to put anything on it, including any dressings, things of that nature. If it's dry, you can leave it open to air. If you pat it dry and there's a little bit of drainage from one of those poke holes or portal sites or the incision sites, then you want to pat it dry, you want to put a little Band-Aid on there, okay? All right. Thanks, guys.